It usually happens in a place you least expect under the unforgiving glare of a supermarket fluorescent light or the harsh downlighting of a department store fitting room. You catch a glimpse of yourself in the mirror, not your face, but the top of your head. And for the first time, you see through your hair. You see the pale skin of your scalp shining back at you, where dense, thick coverage used to be. That moment is visceral. It is a biological alarm bell that triggers a profound, often silent, psychological panic. You aren't just looking at thinning hair, you are witnessing the erosion of your identity. In medicine, we often dismiss this as cosmetic, right? That is a failure of our system because what is happening on your scalp is a direct reflection of what is happening at a cellular level throughout your body. Today, we are dismantling the concept of age-related hair loss as an inevitable decline you must simply accept. We are talking about senescent alopecia. Let's look at the hard data. If you are over the age of 60 inches, the United States, you are standing in the middle of a silent epidemic. Statistics from the American Hair Research Society indicate that by age 60, nearly 80% of the population experiences a significant, measurable reduction in hair density. But here is the terrifying nuance that most general practitioners miss. You aren't necessarily losing more hair than you did at 30. You aren't seeing clumps in the shower drain. Instead, your hair is disappearing in place. The diameter of the individual hair shaft is shrinking. It is a process called progressive miniaturization. Your body is essentially downgrading your hair from thick terminal hairs, the kind that cover your scalp and provide volume, to wispy, transparent, vellus-like hairs that offer zero coverage. You have the same number of follicles, but they are failing to produce visible fiber. Recognize this pattern? We call it the Christmas tree pattern or the Ludwig scale. It starts as a subtle widening of your central part. It looks like the base of a pine tree, narrow at the front hairline, but fanning out wider and wider as it goes back toward the crown. If you are seeing this, your subjective age, how young you feel inside, is at war with your biological reality. And the medical system is failing you. When you bring this up to a standard primary care physician, you likely hear it's just part of aging or it's harmless. This is medical gaslighting. And it is dangerous because it ignores the high threat differential diagnosis that we must rule out immediately: cicatricial alopecia. This is the invisible threat I need you to understand right now. Senescent alopecia is non-scarring, meaning the follicle is dormant, miniaturized, but alive. We can wake it up, we can rescue it. But scarring alopecia is an inflammatory condition where the body's immune system attacks the stem cells in the hair follicle bulge, destroys them, and replaces the follicle with scar tissue. Once that scar tissue forms, the hair is gone permanently, irreversibly. How do you know the difference? If your scalp is itching, burning, or looks smooth and shiny, like a polished stone lacking the tiny pore openings where hair should be, you are in a medical emergency for your hair. You do not have time to try a new shampoo. You do not have time for hair gummies. You are losing time that you cannot buy back. Even if you don't have scarring, simply accepting thinning as your fate is a choice to let your body's regenerative capacity shut down. We know that hair follicle aging is driven by the same mechanisms that age your heart and your brain: oxidative stress, DNA damage, and exhaustion of stem cells. The widening part is not just a cosmetic nuisance, it is a signal that your peripheral tissues are starving for growth factors. In this series, we are going to treat your scalp with the same rigor we treat your cardiovascular system. We are going to stop the miniaturization. But first, you have to acknowledge the threat. The Christmas tree on your scalp is not a decoration. It is a distress signal. And right now, we are going to learn how to answer it. You now understand the stakes. You have looked in the mirror and seen the warning signs: the widening part, the scalp visibility, the sheer lack of density. But to fix a machine, you cannot just stare at the broken parts. You have to open the hood and understand the engine. We're going to descend into the dermis of your scalp, specifically into the hair follicle. First, you must understand that the hair follicle is a biological marvel. It is one of the only organs in the human body that completely regenerates itself over and over again for your entire life. It doesn't just grow, it cycles. Think of your hair production like a manufacturing plant. This plant operates on a strict 3-shift schedule. Phase one is the anagen phase, the production shift. This is active growth. The cells in the root of the hair are dividing rapidly. In your 20S and 30S, this shift lasts anywhere from 2 to 6 years. That means a single hair has years to grow, long, thick, and pigmented before it falls out. At any given moment in a young scalp, about 90% of the factory is in this production phase. Phase two is the catagen phase. This is a short transition lasting only a few weeks. The factory stops production, the follicle shrinks, and the hair is cut off from its blood supply. Phase three is the telogen phase, the holiday. This is the resting phase. The hair is dead and eventually sheds. The follicle remains dormant for a few months before the stem cells wake up and start a new anagen phase. Here is the pathology of the 60-year-old scalp. This is what senescent alopecia actually looks like under a microscope. Your manufacturing plant has undergone a catastrophic scheduling error. The anagen phase, the growth shift, has been drastically shortened. Instead of staying in production for 4 or 5 years, your follicles are clocking out after just 1 year or even 6 months. Simultaneously, the telogen phase, the holiday, has been extended. We call this the latent phase or kenogen. After a hair sheds, the follicle sits empty. It stays dormant. It refuses to restart the cycle. So you have hairs that don't grow long enough to provide coverage, and you have empty follicles that are sleeping on the job. But the most insidious mechanism is follicular miniaturization. This is the hallmark of senescent alopecia. As we age, the hair follicle itself physically shrinks. A healthy terminal hair follicle is deep in the subcutaneous fat, rooted in a rich vascular network. A miniaturized follicle retreats upwards into the dermis. It becomes shallow. Because the machinery is smaller, the product it manufactures is inferior. The hair shaft becomes thinner. It loses its pigment production, turning gray or white. Eventually, it produces a hair so fine, short, and barely visible that we call it a vellus hair. It's like peach fuzz. If you look at a bald man's head, he isn't actually bald in the sense that the follicles are gone. They are still there, but they have miniaturized to the point where they are producing microscopic, invisible hairs. In senescent alopecia, this happens diffusely across the entire scalp, not just in a specific pattern. Why is this happening? It is not just bad genes, it is cellular exhaustion. The engine of the hair follicle is the dermal papilla. This is a cluster of specialized cells at the base of the follicle that signals the hair to grow. It relies on a reservoir of stem cells located in a region called the bulge. In a 6'5" body, these stem cells are suffering from DNA damage and oxidative stress. Think of oxidative stress as biological rust. Every time your cells create energy, they produce waste products called free radicals. Over 6 decades, if your antioxidant defense systems like glutathione are depleted, this rust accumulates. It damages the DNA of the hair follicle stem cells. The stem cells don't necessarily die. They enter a state of senescence. They become zombie cells. They stop dividing. And critically, they stop sending the signals required to initiate a new anagen phase. Furthermore, we must discuss the empty soil theory or scalp fibrosis. Touch the skin on the back of your hand. Now, touch the skin on your scalp. As we age, the skin of the scalp often becomes thinner, tighter, and less pliable. This is due to a reduction in subcutaneous fat and a decrease in vascularity blood flow. Blood carries the oxygen, hormones, and nutrients your dermal papilla needs to survive. If the microcapillaries feeding your follicles atrophy, shrink, the follicle suffocates. The tissue becomes fibrotic, stiff and scarred at a microscopic level. A miniaturized follicle trying to grow in fibrotic, nutrient-deprived skin is like trying to grow a sequoia in a pot of dry, hard clay. It simply cannot sustain the metabolic demand of a thick terminal hair. This is the reality. It is a multi-front war. The growth cycle is too fast. Extended latent phase, the recovery time is too long. The factory is shrinking. Oxidative stress, the machinery is rusting. Asterisk, asterisk, fibrosis. Asterisk, asterisk, the supply lines are cut. This sounds grim, I know, but here is the crucial piece of information. Senescence is not death. A senescent cell is paused, not deleted. A miniaturized follicle is still alive. The machinery is there, it is just powered down. In the next section, we are going to clear the debris. We are going to dismantle the myths and lies. The beauty industry sells you the shampoos and the gummies that do absolutely nothing to fix these cellular mechanisms, so we can focus on what actually turns the power back on. We have looked at the enemy, the shrinking follicle, the shortened growth cycle, the cellular rust. Now, we must look at the weapons you have been sold to fight it. And I am going to be blunt. Most of what you have in your bathroom cabinet right now is useless. Worse, some of it is actively masking the problem or interfering with your medical care. The longevity of your hair depends on your ability to distinguish between biological reality and marketing mythology. Let's dismantle the 4 biggest traps that ensnare patients over 60. Trap Payshone, the stress scapegoat. When a woman over 60 walks into a clinic with diffuse thinning, the most common and laziest diagnosis she receives is stress. Oh, you've been under a lot of pressure lately? That's why your hair is falling out. This is a half-truth that is functionally a lie. Yes, severe acute stress, a surgery, a death in the family, a high fever can cause hair loss. That is a specific condition called telogen effluvium. It is a temporary shock where the hair cycle synchronizes and sheds all at once. But senescent alopecia, the progressive miniaturization we discussed, is not caused by your daily stress levels. It is caused by cellular aging. If you have noticed a slow, steady widening of your part over 5 years, that is not because you are worried about your retirement portfolio. That is the biological clock of your follicle winding down. By blaming stress, you are delaying the treatment of the actual pathology. You cannot relax your way out of follicular miniaturization. You need a molecular intervention, not a vacation. Trap hash 2, the biotin deception. This is the single most pervasive myth in hair health. Walk down the supplement aisle of any pharmacy and you will see hair, skin, and nails formulas boasting 5,000 or 10,000 micrograms of biotin. Let me be clear. Unless you are a starving prisoner of war or have a rare genetic enzymatic defect, you are not deficient in biotin. Biotin vitamin B7 deficiency is incredibly rare in a developed world because your gut bacteria produce it. Yet, millions of seniors pop high-dose biotin daily, believing it will regrow their hair. The clinical data does simply not support this for senescent alopecia. It does not stop miniaturization. It does not extend the anagen phase. But here's why this is dangerous, not just wasteful. High levels of circulating biotin interfere with standard immunoassay blood tests. If you are taking 10,000 mg of biotin and you go to the ER with chest pain, the biotin in your blood can mask the presence of troponin, the protein that signals heart damage. You could be having a heart attack and the test could come back normal because of your hair supplement. It can also falsely mimic Graves' disease on thyroid panels. If you are taking biotin, stop, or at the very least, tell your doctor. It is likely doing nothing for your hair and everything to confuse your cardiologist. Trap hash 3, the gentle shampoo fallacy for years. The clean beauty movement has demonized sulfates. You have been told that as you age, your hair becomes dry and brittle. So you must use sulfate-free, ultra-gentle, or co-washing products. This is disastrous advice for the aging scalp suffering from thinning. The scalp is skin. It produces sebum oil, dead skin cells, and sweat. As we age, cell turnover slows down and dead skin accumulates. Furthermore, dihydrotestosterone, DHT, the hormone that drives miniaturization in susceptible follicles, can accumulate in the sebum on the scalp surface. If you are using a weak, gentle shampoo that doesn't effectively strip this lipid layer, you are allowing a toxic sludge of sebum, DHT, and dead cells to build up around the follicle opening. This creates microinflammation. Inflammation is the enemy of the hair follicle. It accelerates fibrosis. You do not need to scour your scalp with dish soap, but you do need a surfactant that actually cleans. A healthy scalp environment requires the removal of DHT-laden sebum. Gentle is often code for ineffective. Trap hash 4, the iron paradox. Finally, we must address the normal versus optimal trap, specifically regarding iron. You go to your doctor, they run a CBC, complete blood count. They tell you, you are not anemic, your iron is fine, do not accept this. Hair is a luxury tissue. Your body is smart. If it has to choose between sending oxygen to your heart and growing hair, it will choose your heart every single time. Hair is the first thing the body abandons when resources are low. You can be not anemic, meaning you have enough red blood cells to stay alive, but still have ferritin levels, stored iron, that are too low to support the high metabolic cost of hair growth. For hair to stay in the anagen growth phase, most trichologists agree you need a ferritin level of at least 70 ng/ml. Most labs consider anything over 30 ng/ml as normal. If your ferritin is 35, your doctor says you are fine. Your hair says you are starving. The gas tank section of globin might be full, but the storage tank section is empty. Without adequate iron storage, the hair follicle cannot divide rapidly enough to produce a thick shaft. It produces a thin, weak hair or no hair at all. We have cleared the brush. We have stopped blaming stress. We have thrown out the biotin. We are washing our scalps properly, and we are looking at our blood work with new eyes. Now, the path is clear. We are ready to build the protocol. We are ready to intervene. We have identified the enemy, senescent alopecia. We have exposed the myths, biotin, stress, and weak shampoos. Now we execute the battle plan. This is where the fear ends and the work begins. We are going to deploy a multimodal strategy to force your hair follicles back into the anagen growth phase. This is not about hope. This is about manipulating biological signaling pathways. This protocol is designed to be aggressive but sustainable. It targets the 3 pillars of hair survival: blood flow, hormonal protection, and structural nutrition. Phase 1, the fertilizer, topical stimulation, Minoxidil. This is the non-negotiable first step. If you are not doing this, nothing else matters. The tool, 5% Minoxidil foam, brand name Rogaine, or generic. Why foam? The liquid version contains propylene glycol, which often causes itching and dermatitis in older skin. The foam is gentler. The mechanism, Minoxidil, is a potassium channel opener. It is a vasodilator. It widens the tiny blood vessels around the follicle. It forces the follicle to stay in the anagen phase longer and increases the diameter of the hair shaft. It turns peach fuzz back into real hair. The critical warning, the dread. Within 2 to 6 weeks of starting Minoxidil, you will shed more hair. You will see more strands in the sink. Do not stop. This is a physiological necessity. Your follicles are ejecting the weak, miniaturized hairs that were already dead to make room for the new, thicker anagen hairs pushing up from underneath. If you quit during the shed, you are quitting right before the victory. You must commit to 6 months before judging the results. The protocol, apply half a capful of foam directly to the scalp, not the hair, in the thinning areas. Massage it in for 30 seconds. Once daily is sufficient due to the longer half-life in the skin. Twice daily is the gold standard. Wash your hands immediately. Do not get it on your face or you will grow hair on your forehead. Phase 2, the shield, hormonal defense, anti-androgens. Minoxidil stimulates growth, but it does not stop the attack. If your hair loss is driven by sensitivity to DHT, dihydrotestosterone, which is true for almost all men and many postmenopausal women, you need a blocker. The conversation, you must speak to your doctor about this. For men, the gold standard is finasteride, 1 milligram daily. It blocks the enzyme 5-alpha reductase that converts testosterone into DHT. Sexual side effects are the main fear. However, in the 60 plus demographic, the risk profile is often lower than the internet suggests. The alternative, topical finasteride. Compounding pharmacies can mix finasteride into your Minoxidil solution. This reduces systemic absorption and side effects while keeping the drug local to the scalp. For women, finasteride is generally not prescribed pre-menopause, but post-menopause, it can be an option. More commonly, dermatologists prescribe spironolactone. The bonus spironolactone is also a blood pressure medication. If you are a 6'5" year old woman, with thinning hair and hypertension, this is a two birds, one stone medication. It blocks androgens at the receptor site. Phase 3, the tiller, mechanical awakening, microneedle. We need to physically wake up the stem cells in the bulge region. We do this through controlled micro injury. The tool, a dermastamp or dermapen, avoid rollers if possible, as they can tear the skin at an angle, 1 millimeters to 1.5 millimeters, once every 7 to 14 days, never daily. The mechanism, when you create these tiny invisible punctures in the scalp, your body rushes to heal the wound. It releases a cascade of growth factors, PDGF, platelet-derived growth factor, VEGF, vascular endothelial growth factor. We are tricking your body into thinking the scalp is injured so that it sends a repair crew. That repair crew inadvertently rejuvenates the hair follicles, a supercharge. Studies show that combining microneedling with minoxidil increases efficacy by over 400% compared to minoxidil alone. Do not apply minoxidil immediately after needling to avoid excessive systemic absorption, which can cause heart palpitations. Phase 4, the fuel, precision nutrition. You cannot build a house without bricks. Protein, here's 95% keratin protein. As we age, our protein absorption drops. The tea and toast, breakfast is a hair killer. You need 0.8 to 1 g of protein per pound of body weight. If you weigh 150 pounds, you need nearly 150 g of protein. If you cannot eat that much chicken or fish, use a high quality whey or collagen isolate. Ferritin, we discussed this. Demand a ferritin test. If you are below 70 ng/ml, supplement with iron bisglycinate, easier on the stomach, combined with vitamin C, mandatory for absorption. Vitamin D3. This is actually a prohormone. Low D3 is directly linked to alopecia. Most adults over 60 are deficient. Aim for a blood level of 50-70 ng/ml. Phase 5, the dermatologist script. Do not walk into your appointment passively. You are the CEO of your health. The doctor is a consultant. Bring this script. Doctor, I have noticed diffuse thinning and a widening part. I am concerned about senescent alopecia or female-male pattern hair loss. 1, the request for diagnostics. I would like a trichoscopy. I want to look at the scalp under magnification to check for hair shaft variability and to rule out any scarring, parafollicular erythema, or scale. Note, if they just look with their naked eye and say it's fine, find another doctor. 2, the blood panel demand. I want to rule out metabolic causes. Please order a standard hair loss panel, including CBC and ferritin, not just iron, TSH, free T3, free T4, and TPO antibodies to rule out Hashimoto's. Vitamin D, 25-hydroxy. Zinc and B12. 3, the plan. I am ready to start minoxidil. Do you recommend adding a topical anti-androgen or oral spironolactone finasteride based on my medical history? Navigating coverage. Most of these blood tests are covered by Medicare and private insurance, if coded correctly for alopecia. Diagnosis code L63, L64, or L65. The medication is over the counter and not covered. Oral medications, spironolactone, are generic and usually very cheap, often under $10 a month with GoodRx or insurance. You have the tools, you have the script, you have the science. The days of just watching it go are over. You are now actively managing your biology. We have covered the terror of the Christmas tree pattern. We have dissected the rusting machinery of the hair follicle. We have thrown out the useless gummies and built a military-grade protocol involving minoxidil, microneedling, and metabolic nutrition. Now, we arrive at the most critical juncture of this entire conversation: your expectations. The single biggest reason this protocol fails is not because the science is wrong. It is because human patience is short. You are fighting biology that has been drifting in the wrong direction for decades. You cannot reverse 20 years of follicular miniaturization in 20 days. Hair is one of the slowest responding tissues in the human body. It operates on a lag time of 3 to 6 months. If you start minoxidil and microneedling today, and you look in the mirror next week, you will see nothing. In fact, as we discussed, you might see less hair due to the initial shed. This is the valley of death where 90% of people quit. They say, it's not working, and they stop. Do not be one of them. You must view your hair health like a retirement investment account. You do not check the stock market every hour. You contribute consistently, month after month, understanding that the compound interest takes time to accrue. Here is your timeline for reality. Months 03, the purge. You are evicting weak hairs. You are essentially tilling the soil. You will feel like you are losing ground. Hold the line. Months 3, 6, stabilization. The shedding stops. You might notice baby hairs, short, unpigmented fuzz appearing at the hairline. This is the machinery turning back on. Month 6, 12, cosmetic improvement. The new hairs thicken, they gain pigment, the part line begins to tighten. You must also recalibrate your definition of winning. In your 60S, victory is not necessarily returning to the hairline you had at 18. Victory is stabilization. If 1 year from now you have exactly the same amount of hair as you do today, you have won. You have successfully halted a progressive degenerative disease. You have frozen time. Any regrowth beyond that is a bonus, a biological windfall. There is a final psychological trap I need to inoculate you against: the vanity guilt. Society has a way of making older adults feel guilty for caring about their appearance. You might hear, just accept it. Or why does it matter at your age? Reject that narrative entirely. Caring about your hair is not vanity. It is a sign of vitality. It is a signal to yourself and the world that you are still in the game. It is proof that you are still investing in your future self. When you take control of your hair, when you apply that foam, when you demand those blood tests, when you eat that protein, you are exercising agency. You are telling your body that you are not a passenger in a decaying vehicle. You are the driver. There is a profound connection between how we look and how we feel. When you look in the mirror and see a reflection that matches your internal energy, your cognitive function improves, your confidence improves, your social engagement improves. You are not too old to start. The follicle is resilient. The stem cells are there waiting for the signal. Your call to action is simple. Do not try to do everything at once. Do not buy 10 different products. Start with one move. Go to the pharmacy today. Buy the 5% minoxidil foam. Put it on your bathroom counter. Tonight, apply it. That is it. That is the first step in reclaiming your territory. The science is clear. The protocol is proven. The only variable left is you.